My name is Kait Carter. I'm 33 years old. I'm a mom of two. I have an almost 13-year-old daughter and a 7-year-old son. I'm a new patient of Dr. Shakiba's, and I'm anxiously awaiting my surgery. Really excited. All of my symptoms from heavy periods started shortly after I was 12. It's actually a hereditary thing in my family. So most of the women in my family have suffered from endometriosis and severe pelvic pain. I would have blood clots the size. They would vary from a gumball size to golf balls. I had TSS when I was a junior in high school because of how bad my bleeding was, the heavy bleeding, and the cramping, the pain, whether that was my lower abdomen, my lower back. It was so severe, it was debilitating. Heating pads, ibuprofen, ice packs, none of it worked. I couldn't get out of bed most days because the pain was so bad and how much blood I was passing. I was an athlete trying to play on multiple travel soccer teams and playing softball. I also danced. Between the sports and the dancing, I did theater and I've been a painter. So having pain like that, it's not the norm. You're supposed to have a carefree life, enjoy these activities, and that wasn't typical for me. I had to kind of brunt through that. The first instinct was, okay, let's put her on birth control. Oh, that's the first, first indicator of every gynecologist, especially at my age, thinking oh, that's gonna be the trick. I wanna say I went through probably 3 gynecologists as a teenager, and each and every one of them was so gung-ho about birth control. And unfortunately for me personally, I hadn't been diagnosed with PMDD as of yet as a teenager. So every time I was receiving the hormonal birth control, whether that was the pill, I had the NuvaRing, none of it was working substantially, not even just for the bleeding, the pain, any of it. And knowing my mom's history, she had a hysterectomy at 39 and had suffered from all the same things, that I'm okay, well this, again, it's not clicking, it's not making sense. When I had my daughter at 20, that was when it kind of started even ramping up even further. It got even worse with my son, actually. All of the symptoms. The numbness, the pain down my legs, the bleeding even more excessive, to the point that I was having a period for 10 to 12 days straight and only having a break for about 5-6 days and then doing it all over again. That's insane for a woman to have to go through that level of bleeding and pain, radiating in your lower extremities of your body. Again, having a pain that severe, going down your legs and having to be running around, having 2 young kids, it seemed nearly impossible to function, let alone have an intimate relationship with my husband. Was, again, nearly impossible as well. Really didn't have any intimacy for years because if we did try to, I was in pain. Then there's, top on bleeding after having intercourse. Again, it was this vicious cycle that didn't stop. And then I'd be okay, let's find the next doctor. I'd find the next doctor and he'd be birth control, you need to do this. We'd do every ultrasound and he'd be there's nothing wrong. I wanna say it was in 2022. Yeah, I got the COVID booster and that had triggered this really intense autoimmune response in my body, and I started suffering from a myriad of other health issues, from cardiac to cardiovascular and endocrine, you name it. It was just this snowball effect of all these different things, countless hospitalizations for that. I ended up seeing another new gynecologist, again, trying to address the bleeding and the pain. And it was interesting because he was oh, you're the perfect candidate for an endometrial ablation. And that was the first time that I ever had a doctor suggest something other than birth control. Just seemed oh, maybe this is the light at the end of the tunnel. I was very wrong, extremely wrong, because that was only when what I thought had gotten worse got even more extreme than I was already experiencing, because little did I realize what was going on inside, and not knowing more about endometriosis and the causes and effects of that and what an ablation does. So by him cauterizing my uterus, that was just causing more scar tissue, more damage. That was causing me all of this pain, all of this numbness, that it was unimaginable, to the point that I thought I couldn't get out of bed most days because of that pain radiating down my stomach and my back. It was, sometimes I can't even put into words how extreme the pain was. I'm like, I can't go to the bathroom, I can't get out of bed, I can't do things with my children, with my husband, with anyone in my family. Like, that, what kind of quality of life is that? And that pain just continued to get larger and larger and larger. I like to be very intuitive and listen to my body, because I've had so many doctors dismiss my pain and everything that I've gone through that I wasn't going to take no for an answer. And that's when I had found another gynecologist. Thank God for that, because she was so kind and compassionate and trying to understand what I was experiencing. And she had realized that it was out of her purview and her expertise, and she was the only one listening, and that was when she referred me to Dr. Shakiba. That was the glimmer of hope that I had been really waiting for. Yeah, the first thing that I loved once he walked in the door is that he did his diligence to completely review everything that I had provided about my past history, and he immediately opened his phone and started recording our session. I had never experienced that before. You know, most providers, they want you in and out. They don't take the time to listen. The fact that he spent over an hour with me and was, again, equally, if not more, kind and compassionate and thorough. He understood all of the things that I was experiencing. He then gave me further education onto what I was experiencing. It's like he could read my mind and knew exactly what my body was feeling, and then take the time after having my exam to break it down so I really understood what the full spectrum of my surgery is going to look like, and then going into full detail as to each individual thing. And I'm a note taker. I don't go anywhere without my notebook. I'm super high attention to detail, so, you know, as he's explaining everything, I'm sitting there taking my notes. He's answering my questions, I'm answering his. You know, it felt good that we were already establishing a relationship and felt like a team, knowing that I was going to be in the right hands. And not only just him, but every single person in the office that I've had interaction with really took the time to, again, make me feel heard and go above and beyond to help with my situation, which, again, most doctors' offices don't do that. I know that this is the perfect fit for me moving forward with my surgery. Like, knowing that in the very near future, I'm going to be able to actually enjoy doing this activities I used to do, yoga, doing different sports and stuff with my kids, and being intimate with my husband again, that I get to look forward to. So it's a weight lifted. No, after experiencing this for the last 20 plus years of this just chronic debilitating pain, you know, I cannot, reiterate enough how excited I am and relieved that I finally found Dr. Shakiba, and I'm anxiously awaiting to have my surgery. You know, putting that date on the calendar is something that I'm really looking forward to, knowing that I'm going to finally have the relief that I've been waiting for so long.